Hi everyone, I'm Alison, Deputy CEO at Southern Brooks Community Partnerships. We're a community development charity working across the whole of South Gloucestershire, providing a really broad base of community development support. We work with people to help them find employment and volunteering opportunities. We work with them to support their emotional health and well-being. We provide youth work. We provide all sorts of broad opportunities. We have a social prescribing service, and we've been working in the area for about 30 years. So we're well established, and we have really strong relationships with all sorts of other voluntary sector organisations and with our statutory partners, and I hope that that will come across when we're talking to you about our COVID response. That was really important to us at the point lockdown was announced, because it has been the strength of our relationships that's helped us carry through and to work collectively with our colleagues to support our communities as best we can during lockdown and beyond lockdown. So I'm going to hand over to my colleagues now, who are each going to talk about a different aspect of our work.
Hi, I'm May. I'm Employment and Skills Development Manager at Southern Brooks, and I also coordinated our phone service during the COVID lockdown. I'm going to talk a bit about the phone service we provided. It came about following discussion with South Gloucester Council and the CVS about how we could best support the community, and from that we set up the helpline since April. The helpline predominantly gave advice and guidance about all the support options that were going on in South Gloucester. During the service, we delivered food parcels for the shielded alongside the council and the Green Community Travel team. We also provided emergency food parcels as part of our Fair Share Food Parcels project. And we also helped people collect and deliver their prescriptions. And that was done using our own staff there and team, an amazing group of volunteer and runners, the local mutual aid groups, and the transport team at South Gloucester Council. We also would link in our callers to the local mutual aid groups. And we always had a wellbeing team member on call to for any additional support that people needed. Throughout that time, since April, we delivered over 500 food parcels, over 95 prescriptions, and provided wellbeing support to roughly over 50 people.
Sarah, and I'm a wellbeing worker for Southern Brooks on behalf of One You South Gloucestershire. Today I'm going to talk about peer support and how this has been adapted over the COVID situation. So to start with, we had peer support groups running in South Gloucestershire in different locations, but because of COVID we've had to adapt this. So what we did was we took the peer support groups online and we used Google Hangouts. So what this meant is it could give the support to people who needed it, so that they were still receiving that support and those connections were maintained. So via Google Hangouts, it was really good because it meant that people could, that they could have those connections with each other and give each other that mutual support through the difficult time that they were experiencing. And it also meant that even if people didn't have access to videos or to online, if they didn't have the skills or technical skills, they could still call in. So that was really good, and that meant that they could still have those connections even if they weren't very technical in maybe if they had some barriers to being able to access online services, they could still call in and use the telephone. We are thinking in a longer term basis to actually continue with some of the online service delivery, because it has actually helped to reduce some of the anxiety for some of the participants, because they've found that it's actually for some people took that barrier away of having to actually go into a room. But as well as this, we have actually also been delivering the peer support as things have changed and the COVID situation's changed, to the parks in the local area as well. So they've been done in groups of 6, and we've also had volunteers supporting that. So if the groups are bigger than 6 people, we've still been able to deliver that. So yeah, so that I think is everything. Yeah.
Hi, I'm Toria. I'm the social prescribing manager for South Gloss. The social prescribing team ordinarily would have been based in GP surgeries across South Gloucestershire supporting patients. During COVID, we've all been working remotely and supporting people via the telephone. We've had over 650 referrals into our service since the end of March. And we found that working over the telephone has actually been really, really beneficial for a lot of patients. We've been able to really concentrate on what matters to an individual and be able to really thoroughly assess what their needs and be able to support them to put what they've needed in place. And moving forward, I can imagine that a lot of telephone-based practice will continue in our service because it's meant that we've been able to reach out to a significantly higher number of patients than we may have otherwise ordinarily been able to. Thanks.
Hi, my name's Jenny and I'm the Sustainable Communities Manager. Back at the beginning of the year, we all thought we knew what we were doing. We knew what we were delivering as a team, as an organisation, and communities were living their life, and along came COVID, and that changed everything. So we had to start thinking about how we would deliver the service that we were providing in a different way and look at the skills we had and how we adapted those. Now, one of the main things that we did was to support the marvellous mutual aid groups that sprung up. And these mutual aid groups, some of them were quite small. It was just neighbours helping neighbours. Others were much larger, covering large postcode areas. But they were new to doing this as well. So the team kind of sat under them, supporting them with CVS as well to help them be what they want to be and develop what they wanted to do. Alongside this, we also developed a whole team of volunteers, over 100 volunteers, that helped Southern Brooks do what they did. And we wouldn't be able to have achieved as an organisation half of what we did if it wasn't for the mutual aid groups. Within the team, what did we learn? Well, we learned we had to be flexible. So one of the team at Cranley Court wasn't able to run the food project in the cafe anymore, so they adapted that to support the organisations who were delivering food and meals, and by supporting them created over 5,000 meals for the community. So by thinking differently and doing things differently, by being flexible and both being so they could do. So one of the things we really learned as a team is that we needed to trust each other, trust the skills that we have, support each other, be flexible, and to work in partnership with our partners, whether it's South Gloss Council or CVS, and collectively, by doing things differently, we were able to make a difference in communities.
So my name's Tanea Cummings, I'm the Head of Employment Skills and Youth. For the youth work, we had to change how we delivered drastically. So one thing that we done was we set up phone calls for the most vulnerable young people in Patchway, the area that we work in. We phoned on a weekly basis 44 different children and young people and families. And actually through doing this, it's helped us build relationships with the parents that we previously didn't know. Through those conversations, we've also been able to find out if they've been struggling, the family's been struggling mentally or financially, and we've been able to help out. We've also, with the young people, just been able to talk to them through their mental health. We've signposted them to online mental health support, but also just being able to keep in contact with them has really helped them. Because a lot of the children and young people were starting to get bored, not having things to do, especially families who were struggling financially, we managed to get some money from funding to create and deliver 1,600 art and craft packs. So our youth centre took on a very different appearance during the lockdown, that it became a packing centre where volunteers went along and they created art and craft packs. And then we worked with all of our partners across South Gloss to identify the most vulnerable children in the area and deliver those art and craft packs. For several parents, we had some fantastic feedback that it was a lifeline for them, especially one family who had a child who she was severely autistic, would regularly have meltdowns. Both parents were furloughed, so funding was very, very tight. And these art packs, the young girl was very creative, so it gave her something to do and it gave parents respite. Another thing we done during lockdown, as Jenny alluded to, was looking at our resources. So we have a cafe, which we received fair share food. And rather than stopping that happening, we decided that we would use that food to deliver to families that were really struggling financially. So we delivered on average about 25 food parcels every week. They were created by a team of volunteers headed up by Jenny's team. And we also had Green Community Transport who got involved with going and delivering some of those alongside some local MPs. Through doing both of those things, the art packs and the food parcels, a really good case studies come out. So a family that we were talking to on a regular basis, because the young people were struggling with their mental health, and parents, they actually, unfortunately, due to COVID, had 3 deaths within the family within a very short period. Mum was furloughed, and a single parent family, so they were really struggling financially. So because of everything we've changed within our service, we were able to provide art and craft packs for the children. We put the mum in touch with the wellbeing service, so she's now receiving weekly phone support and is able to access that. Also food, because they were really struggling to be able to put food on the table, is we were able to provide fair share food for her on a weekly basis, but we also managed to get some additional funding to be able to do the staple food that they really needed. So that was kind of a really good example of cross-team working and what we've been able to offer as a service.
Thanks. So my name's Helen Bradley. I work for South Gloss Council in the public health team. So ordinarily I work across community development and health inequalities. And so a lot of the partnerships that have built up through COVID had their foundations in the work that we've been doing for a number of years. So COVID's really pulled together this community support system that we've been working on for a while, whether that's been through formal contracts such as our One New South Gloss work that pulls together a number of partners with the local authority, or Active in Life. We've never had a catalyst quite like COVID that's meant that we've had to really get on and be flexible and really give each other permission to change practice for the best. It's always been that very slow grappling that you get, but COVID's been a real catalyst for that. So we've done a lot of changes and we really strengthened those relationships in a number of ways. We've been able to advise each other as we go. Those relationships have become so strong that there's real trusted relationships between our organisations and the wider voluntary sector. And the community support cell has really brought together all those wide partners so that we're really making choices together as a system. And that included how we diversify the One New South Gloss work, whether that's on the wellbeing side or our internal side. That service has really diversified whilst maintaining its core purpose of supporting vulnerable people within our communities. So it's maintained that core, but it's been able to change its practice to work with shielded residents and to work with those that are more vulnerable because of COVID. But like I said, the new structures have been put in place. They're built on existing resilience. So our communities have got a number of different networks, particularly around the priority neighbourhoods, that have got existing resilience. We've got existing networks, we've got development workers in those areas, and they've connected the community, which has meant that when COVID's come along, we've been able to rely on the skills of the development workers out in the community. So when these mutual aid groups have been popping up and the community's been showing just how resilient it is, we haven't had to go in there as a council building up relationships from scratch, or having that sort of hierarchical relationship with the community. We've been able to do it on a number of different levels rather than just having this institutionalized perspective. So that's been so valuable in creating trusted relationships with our community. And it was so important that we used the development workers from the priority neighbourhood contract to do that, because that skill base was there where it isn't in other different contracts that we have with other workers. So that's been paramount to the whole thing. Early on, we started a practitioners level meeting that was specifically meant to support our working relationship around food and shielding, but actually it very, very quickly grew to incorporate a lot of the wider determinants, or just looking at everyone from a very holistic perspective. we were bringing people into the meeting, we're bringing cases into the meeting, like totally anonymised, but bringing them in and then troubleshooting them as a whole system. So we'd have people from employment, from youth, from social care, the GPs, social prescribers, the voluntary sector, and we're all able to troubleshoot our pinch points at practitioner level. And for me, that's been one of the biggest shifts in our thinking in the local authority, is to bring confidence to the practitioner level, whereas often our partnership working happens at a very strategic level, but COVID's really shown how much we need to be information sharing at practitioner level to give confidence to those that are actually working with people, to really give that information and trust our workers to do their jobs and to change your practice in the best way that you've been able to do it. So it's been a massive system approach, and I'm so grateful for the whole voluntary sector for getting on board with this, and Southern Brooks for being such a key partner in that. I don't think the local authority would have been able to respond nearly as well without our voluntary sector partners, and that's been absolutely key for a number of years, really, around health inequalities. But COVID's really provided that opportunity. So I think that's all I need to say from our perspective, but it's been a real privilege to see this area of work grow, particularly around health inequalities.
So we hope that's given you a flavour of our COVID response, and how I'm sure you'll have heard that relationships have been at the heart of everything we've done. Relationships between organisations, between individuals within those organisations, relationships with the mutual aid groups, with our communities. And I think what you will also have seen is our internal relationships and the strength within Southern Brooks of our leadership and management teams. Our staff have absolutely stepped up to the plate in order to deliver the COVID response that we've just talked about. So going forwards, we're still working, of course, with the local outbreak management plan with our statutory colleagues. We've managed to pull in some funding from the lottery and support some funding from the council to continue our mutual aid group support. We're planning a piece of work around digital exclusion, because of course that's come into really sharp focus during COVID. And yeah, we're continuing our discussions, our conversations, and strengthening our relationships as we go forwards into post-COVID or continuing COVID, whichever the world is going to bring us. Thank you.